Can I just say, guys, I haven't got, because I'm in isolation, I haven't got my running sheet and all that in front of me. I've just got it on my phone. That's going to be okay, isn't it? I mean, it's all going to be pretty easy to follow, I imagine.
Yeah,
Yeah,
I'll guide you through it. Yeah.
Yeah, I thought so. I just couldn't get to work in front of it. Thank you.
we'll remember everything, Jim. Just don't forget the joke.
Oh, yes. You mean life?
What, sorry?
You mean life itself?
Well, that's true. Yes, sometimes it does play tricks on us. There's no doubt about that.
I'll wait for my profound comments at the right time. I'll hold them in for now.
You're a profound man right through and through. We all know that. We've known you for too long to think of anything less.
I don't have to tell any jokes, do I, Jim?
No, I'm not including you in the end joke, but just Jim. It's all right. I did think of you. You would be a good foil for it, but then I thought, no, all right. You might not be a Monty Python fan.
There's only room for one comedian here.
Well, maybe, yeah, only one. You're it, Jim.
Jim, if it makes it any easier, you're scheduled to talk at 1:31 p.m. So assuming that we're running on time,
Sure.
I'll be throwing to you, and you'll be going after Nico Callahan. So,
okay, because I've got myself down, or on the agenda, I've got welcome and address at 1:07.
Sorry, no, I mean Jim Beer. Sorry, Jim.
Oh, I'm sorry,
Jim. No, you're right. Yeah, just because Jim mentioned he didn't have the run sheet in front of him. So that's
sorry.
There's only one real Jim here.
There's only one.
Sorry, I should have made that clearer.
There's only one Jim B.
Sorry.
All right, we've just clocked over at 1 o'clock. Are we ready to go, everybody?
Yes, you can start, Heidi.
Great. Thanks, Nithya. So thank you so much for joining us today. My name is Heidi Aluka and I'm your MC for today's event. I want to firstly acknowledge by welcoming everybody here today and acknowledging the lands of the Wurundjeri people, who are the traditional custodians of the land on which I am gathering today. I also want to pay my respects to the elders past, present and emerging, and pay my respects to any Indigenous Australians who may be joining us today. On behalf of the Mental Health Foundation Australia and the chairperson, Mr. Vasan Srinivasan, I would like to welcome and thank each and every one of you for attending the Carers Mental Health Forum today, which is organised as part of National Mental Health Month Awareness Campaign. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health as a community. MHFA's National Mental Health Month is unlike many other or any other mental health awareness campaigns. It aims to bring all Australians together in a nationwide conversation about mental health. And we aim to maintain this conversation for an entire month, but also beyond the month of October. We do this through a series of various mental health related events. The program of events during Mental Health Month is one that MHFA and myself are extremely proud of, and we intend to reach out and educate as many Australians as possible. And the aim is really to help reduce stigma and facilitate positive and non-judgmental discussions surrounding the important topic of mental health in Australia. With 1 in 5 Australians experiencing a mental health illness each year, it is time we give mental health its due attention. And that is exactly what MHFA is wanting to achieve. Throughout this month, many events have been organised in each state and territory of Australia, and we hope to unite Australians of all ages and backgrounds to raise awareness of the need for better mental health for all. This year's theme is post-pandemic recovery challenges and resilience, and it will focus on raising awareness for mental health in various industries and communities. Every individual has faced, and many are still facing, unprecedented challenges due to the COVID-19 pandemic. With this in mind, we want to extend our campaign even wider than in previous years, with events planned to embrace many different communities and groups of all ages that are all walking on the road to recovery and fostering resilience. So let's begin with today's event. I want to first ask you to join me in celebrating the journey of MHFA by viewing this short video.
Hi everyone, I'm Vasan Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years. With Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020 and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to a virtual platform, very much being able to pursue our objectives of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to 100,000 Australians all across the country for our national walks for mental health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is mental health and post-pandemic recovery challenges and resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DB Results and take up the wellbeing app Am I OK? to support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, Am I OK? Am I OK also alerts the user when it's time to seek outside help. We thank DB Results for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board directors and patrons, scientific advisory committee members, our wonderful staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continuous support to our organization as we continue to work to deepen understanding of the importance of mental well-being and educating the community. Let's work in solidarity for the benefit of our mental health. Thank you, Australia.
So well said, Vasan, and I second that. I think it's been amazing to see MHFA pivot. Early last year when we went into lockdown and we had an array of events that were planned to take place in person, MHFA had to pivot and do these virtually, and we've now had to do it again this year. And I think one of the benefits has been our ability to remain connected throughout Australia, and we've been able to reach people that may otherwise not been able to connect with us if they had to attend in person. So that's one of the silver linings that I'm taking away from the last year and a bit. I think this is an amazing discussion that we're going to have today, and I'm really excited for today's lineup. I've also been impacted by a person who in my family played a caring role. My mother cared for my grandmother for many years who suffered from Parkinson's disease, and I know all too well the impact that being a carer and putting the needs of someone else ahead of that person, the carer's own well-being can have. So I think it's a really wonderful thing today that we're focusing on carers' wellbeing and mental health. To kickstart our discussion, I want to welcome Jim Gooden, who is a former Vice Principal with over 30 years experience. He is the Vice Chairperson of Mhfa and currently the President of the Mental Health Foundation of Australia. He's the co-chair of the Victorian Mental Health Month Advisory Committee. Jim is also a committee member on many other boards and committees, including the Royal Australian and New Zealand College of Psychiatrists, the Chisholm Institute Course Advisory Committee, and the Melbourne Bipolar Network. Jim was also the former Vice President of the Australian National Association for Mental Health and former President and Secretary of the OCD Foundation, now ARC-VIC. Jim's knowledge of mental illness comes from his professional, voluntary and family experience. Thanks so much for joining us, Jim. Over to you.
Thank you, Hadia. Can you see me and hear me clearly enough?
I can.
Thank you. Well, welcome to all of you. As Hadia did, I would like to also pay my respects to the original custodians of the land from which I speak, the Wurundjeri people. I also pay my respects to all the original inhabitants, past, present, and their generations emerging. Today we address the needs, health and welfare of the great unsung heroes of mental health care in Australia, the 1 in 10 at least, who are the foundation of mental health care, seldom acknowledged as such, unfortunately. A carer may be the person's husband, wife, partner, son, daughter, parent, neighbour, friend, and in some cases, as we will hear today, just very decent people who are committed to the welfare and recovery of complete strangers to whom they volunteer their time and their humanity. Carers invest time, energy and support, generally unpaid and unacknowledged. Some may receive carer payments to enable them to continue their caring role, or small or no disbursements to support groups, to run support groups. Carers are often hidden from public awareness and do not see themselves as carers, but can be motivated by internal forces we barely have language to describe. Former chairperson of the Mental Health Foundation used to call this motivation often fire in the belly. And I think that's a very good description of what motivates some of us in the mental health field, fire in the belly. The emotional stresses and strains of caring for someone who has a mental illness can be quite brutal. Often carers are denied the ability to tell their story to treating doctors and clinicians. Many sustain emotional damage and themselves may over time require care. Perhaps from today's forum, we will better be able to understand their wants and needs and promote a more accurate recognition of their massive contribution and how better to serve and acknowledge them. Thank you, Hadia.
Thanks, Jim. So well said. I want to now welcome Professor Greg Murray. Professor Greg Murray is a great supporter of Mental Health Foundation Australia. Due to his commitments, he is unable to be with us here today, but he has sent us a recording of his address. Please join me as we watch Professor Greg Murray's address for us today.
My name's Greg Murray. I'm a professor of clinical psychology at Swinburne University and the director of the Centre for Mental Health at Swinburne University. And it's a great pleasure to once again be participating with the Mental Health Foundation of Australia in one of their public events. The Mental Health Foundation of Australia does wonderful work throughout Australia, really in encouraging people to get the best out of their mental health and identifying particular challenges or groups of people who might need a bit more support. And the aim of today's session is, of course, to focus on carers of people who have mental health problems, which is a very important role. My area of research and clinical expertise is bipolar disorder. And in bipolar disorder, we know that the carers have a very important role to play. And we also know it's a very difficult role. when I'm speaking to carers of people with bipolar disorder, I'm reminded of that famous saying that a parent is only as happy as the most unhappy of their children. We do get very affected, don't we, by the emotions and challenges and struggles of people who we care about. And in our work with carers of people with bipolar disorder, there's a couple of key principles, and I'm not trying to be an expert or tell you what to do, but there's a couple of key principles that we find do seem to matter to most people who are carers of people with that particular condition. And there's sort of two chunks of things. One is about you, and one is about your role in helping the person with the disorder. So in terms of the carer themselves, there seem to be sort of three major ideas that keep coming up. One is to educate yourself about the disorder. It's really important that you develop some expertise on the disorder, so you know what to expect, you know where the disorder stops and the person starts, to know what sort of treatments are likely to be offered and what the evidence is for those treatments. So that, developing expertise on the disorder is a really important thing. And second, and it's common sense, is make sure that you yourself are getting the support you need to play the role. And there are all sorts of groups and websites for carers of people with specific mental health conditions. And I'd encourage you to make sure you're linked up with that community. And I suppose psychologically, the third thing is the importance of sort of maintaining an optimistic outlook and being patient with the problem. I was speaking to a parent the other day whose daughter has just been diagnosed with bipolar disorder, and obviously there's kind of an air of panic about that. But I was able to say to her, because I've been through this sort of thing a number of times, that panic does pass. And we start to learn a bit more about it and start to get into our routines and start to get familiar with this new reality. And that's, as people mature in the role of carer, we do see them being able to be more patient and more optimistic than they were when this problem first arose. And then the second set of issues that seem to be important for carers is to think through what exactly is their role in relationship to the person they're caring for. And so there's a couple of points about that seem to keep coming up. One is the importance of simply listening to the person with the disorder. That is, not judging, not pushing, just being present with them and being a sounding board for them. The second point that seems to matter is, as much as you feel capable, being active in their treatment. Now, that doesn't mean you're treating them, but that means being conscious of what we call the illness work. Whenever we humans have an illness, whether it be physical or mental, there's a lot of work that goes with it. This is one of the major quality of life challenges, actually, of having a chronic illness is looking after yourself, going to those appointments, getting the prescriptions filled, all that sort of thing, finding a new doctor if yours retires, that sort of thing. So that's a significant piece of work for the person with the disorder that their carer can help with. That might involve, driving them to appointments, sitting in the waiting room, asking them how did it go, if that's what the person with the disorder wants, but supporting with that work. But as I say, the carer is not the treater, they're not the professional. And we do hear from carers sometimes that things go better once they accept their role as a carer and, as it were, devolve the treatment to the professionals. That's what they're being paid to do. So being really clear about the different people on the team. Some of them are professionals. In the case of bipolar disorder, the condition I know a bit about, some professionals are prescribing medication, some might be offering psychological therapy. The person with the disorder may also be going to a support group, a whole range of people involved in their care, but the carer has one particular role and it's different to those other roles. And so we find that carers manage their role better over time as they become more confident with the boundaries between their tasks and the tasks that the professionals are paid to do. So look, that's just a couple of thoughts from my point of view and my experience. As I say, I wish I could talk to you face to face, and obviously in that situation, I'd be saying, you tell me. I'm very interested in the expertise of the carers themselves, and I'm not trying to put my insights above those in any way. This is just an introduction to what I hope will be a very enjoyable and stimulating and engaging set of discussions for you. Best of luck.
Thanks so much to Professor Greg Murray. I certainly took a lot away from his address, and I've been taking notes throughout his presentation. So thank you very much for your time. It was a real privilege to hear from you. I'd now like to welcome Mr. Anthony Carbines, Parliamentary Secretary for Carers and Volunteers. Anthony was selected State Member for Ivanhoe in November 2010. Following re-election in 2014, he was appointed Parliamentary Secretary for Water and Parliamentary Secretary for Energy, Environment and Climate Change in the Andrews government. After the 2018 election, Anthony was appointed Parliamentary Secretary for Health. He's currently the Parliamentary Secretary for Carers and Volunteers. Please welcome Mr. Anthony Carbines.
Sorry, we can't hear you.
Anthony, you might be on mute. Very easy thing to do, or it could be an issue with Zoom.
Yeah, I don't think he's on mute. Maybe just adjust your speaker, Anthony, on your side.
We'll just wait a couple of moments in the event that we can reconnect with Anthony.
Have you got me there?
Oh, yes, we can hear you.
This is good. You know what? This is a bit unorthodox, but what's happened is our IT, just like that, if you don't mind. What happened yesterday is they changed all our IT over. Oh. And so you could imagine you're our first test run with new computers and the software. We haven't been able to make sure that everything's perfect. But in the midst of all of that, all our new shiny equipment, we've gone back to the trusty iPad as our backup. So how about that?
Oh,
we found a way to adapt.
Done.
So sorry to hold you up there, but can I just say to Jim Gooden, great to hear from you, the Vice Chair of Mhfa, to Nick O'Callaghan, of course, as the Executive General Manager of Australian Unity, the event sponsor. Of course, all the guests who are joining virtually, thanks so much for the opportunity to be with you. And of course, wherever we are online, we're on the lands of the traditional owners. And I wanted to also add my welcome to an acknowledgement of country and to any traditional owners who may be joining us online today, to their elders, both past and present. Can I say also it's Carers Week. It's an opportunity for us to reflect on the really important work in relation to mental health that those carers do in our community. And I understand too from some of the conversations we've heard from already that there's an acknowledgement and understanding of how significant that work is. Part of what's been we've announced through this week alone, there's been about $2.5 million around our carers grants. Some of that's to some 56 organisations under our Supporting Carers Locally grants. And of course, that's about helping carers to reconnect with one another. There's about bushwalks, online cooking classes, a range of things that perhaps have been harder to do in lockdown here in Victoria. but trying to think differently about how we maintain connections and opportunities for wellbeing and the mental health of those who care for so many people in our community. We've also had, for statewide partnership grants, nearly $1 million around peer support programs and financial advice, which is also really important for those who care for others. Often when you're prioritising and focusing so much on those who need our care, you can let your own needs fall behind. And we've been really determined to make sure that those supports are picked up for people so that they find the support and time to look out for themselves, because if the carer wellbeing is improved and strengthened, then their role and task providing support to others is also strengthened and improved. As part of course, you'd be aware of $50 million carer strategy over the past 4 years, moving into the 4th year next year, where a large proportion of those funds have been about additional respite for carers across Victoria. MFHA is such a critical organisation when it comes to mental health support for people through advocacy and awareness, education and support, research. Resilience has just been so important over the past year and a half in particular. And when you talk about some 239,000 primary carers in Victoria and some 740,000 carer families just in Victoria alone, it's a really significant number that really outlines how many people are touched by the work of carers, and the people with mental health challenges and supports that are required. And so many people are making that contribution as volunteers, but also as recognised carers in our community. Health and wellbeing is so critical, as I touched on. Social connections are critical. Managing stress, eating well, financial advice, and all those other aspects that sit behind making us feel in control and confident about how we're living our lives when we're committing so much of ourselves to the wellbeing and support of others. What we've also found during the COVID period is trying to think a bit differently about what we want to do. So online learning experiences, exercise classes, different recreational activities, regular phone calls to keep carers connected. How can we make sure there's self-care packs being made available, healthy food parcels, trying to make up for the time that is often squeezed for carers and the commitments that they make to so many people. I wanted also to touch just briefly again on the Royal Commission into Victoria's Mental Health Services and what that's meant. Particularly, there are some recommendations about carers. That's really significant. It brings again, as we accept all of the recommendations of the Royal Commission into mental health, that there's a particular acknowledgement in those recommendations around carers and particularly their wellbeing to sustain and strengthen and advance the interests and the wellbeing of carers is just critical to the broader supports we want to provide as we recast mental health services in Victoria. We've already provided some $93 million for dedicated help for families and carers through mental health services, but the acknowledgement in the Royal Commission findings about the role of carers and the supports they need is really critical to the work that we want to do. Just the last couple of things I also wanted to touch on was we're expanding our mental health programs to support young carers and children, young people who have a family member living with a mental illness, through peer support and workshops, educational programs. Really keen to hear how else we can, your feedback and work that we could do together in relation to those matters. We're recording more data now in schools so that there's greater supports for carers who, in a young family, they may feel they're just doing their family role. We would acknowledge from outside that they're also doing a critical role as a carer, and there's supports that they need in their education and as they grow, that they should be able to access it and be acknowledged and strengthened for in their work as carers, not just as young people taking on significant responsibilities in their family. And these are the ways in which, through the carers strategy, a greater acknowledgement, a broader understanding across government and our services about the different roles of carers, and those who care and perhaps don't acknowledge or recognise themselves as carers and the work that they do and the supports that are available. It's why advocacy and organisations such as yours are so critical to making sure we can work together to support so many carers that then provide much better service to those, for example, with mental health issues and illness who require the support of our services, but also of people in their family and friends in their carer roles. And just lastly, can I say that we also funded some other organisations I'm sure you're familiar with, like Tandem, a peak body for carers of people with mental health illnesses to support Victorians who care for those with mental illness. They play a great role. Mind Australia, Sane Australia, Mental Health Carers in Carers Australia, Beyond Blue, and other similar organisations. We've got a lot of work we're able to do together. The collaboration is critical and important. I really appreciate the opportunity to talk with you today and understand a bit more about some of the work that you're doing. We really appreciate your collaboration and advocacy and the supports that you're providing. And I hope both in National Mental Health Month and National Carers Week, it's not only an opportunity to reflect on what we've been able to do together and where we need to go, but I think draw strength from the fact that there is progress and there is a greater understanding that we're building together to support those with mental illness, the families and friends who count and support and rely on them, and those carers in our community who need our support, not only to the work that they do in a selfless sense, but to make sure that their wellbeing is being advanced and supported. Thanks very much for the opportunity to spend some time with you today.
Thanks so much for your address, Anthony, and for standing in solidarity with MHFA and being committed to improving the mental health and wellbeing for all carers. I've certainly gained a lot of insight from you sharing a lot of those details with us, in particular the adoption of the recommendations from the Royal Commission and the money being invested in supporting carers and in particular young families. And to know the number of people, the number of families that are actually carer families is quite remarkable. So thank you for sharing that with us. A token of appreciation and gratitude in the form of a plaque from MHFA will be sent to you in the post. We'd love to have handed it to you in person, but given our virtual setting, we'll send that in the post to you. Thanks so much.
Thank you very much. I appreciate it.
I want to now mention that sponsors are a really vital part of any organisation functioning, particularly not-for-profit, including MHFA, and it's important for us to create a high impact awareness campaign, including the one that we're running at the moment, the National Mental Health Month. One of the major sponsors for the foundation is Australian Unity. Representing Australian Unity, we have Mr. Nick O'Callaghan with us. Nick is the Executive General Manager of Australian Unity's Home Care Services. Home Care Services provides support to over 30,000 customers, enabling them to stay independent for longer in their own homes. With a workforce of over 4,000 qualified and caring individuals, customers have tailored wellness plans to fulfil their personally chosen outcomes. Nick is well known for his leadership strengths in strategy, business development, and operational delivery, and has a strong sense of community, particularly for ageing Australians. Welcome, Nick. We look forward to hearing from you.
Thank you, Harrier, and sympathies actually, Anthony, on your IT issues. I think was something we're all familiar with, particularly through our remote working over the last 18 months or so. And good afternoon, everybody. I also would like to start by acknowledging the traditional owners of the land in which we're all meeting today and pay my respects to elders past and present. Also want to recognise the work that the Mental Health Foundation of Australia do and their great work in the mental health space. So thank you, Jim, particularly for the invitation. And this Mental Health Month, which is held in October each year, gives us an important opportunity to raise awareness about the mental health and wellbeing. It's also a chance to promote the activities and the ideas that have been and can have a positive impact on our daily lives and the lives of others. So I've been asked today just to quickly speak to you and share with you the impact on mental health on carers from the context of Australian Unity. So as I've been introduced, my name is Nick O'Callaghan, the EGM for our home care services business at Australian Unity. And we do providing home care services to around 30,000 customers throughout Australia, just to help them stay independent in their homes. We also provide retirement, community living, aged care homes, allied health, Indigenous and disability services. So as you are, of course, aware, Australia is one of the most culturally diverse nations in the world. So it is crucial we provide services and programs specifically tailored to meet the mental health needs of our culturally and linguistically diverse communities. So it's estimated that between 25 and 30% of all Australian carers are from culturally and linguistically diverse backgrounds. And this figure is likely to be underestimated due to a traditional lack of reporting or identifying of the care role within COLD groups. So organisations like Mental Health Foundation of Australia are working to address these shortcomings through research programs and services for COLD Australians. Australian Unity also works on this and understands the need for targeted services, and we've developed specific healthcare and wellbeing services for culturally and linguistically diverse Australians. So you may know that work-related stress is the most common issue in Australian workplaces, and the aged care industry is certainly no different. So working with seniors can be very rewarding, but it also obviously can take its toll on the health of care workers. So caring for some of the most vulnerable people in society and dealing with emotional issues such as deterioration in the customer's health can certainly be challenging. So it's little surprise that stress is commonly experienced across our care staff and our extended care fraternity. There is also evidence that people from ethnic minority backgrounds seek less support from services, possibly as a result of increased stigma or alternative health beliefs, reduced knowledge about dementia, and a perceived lack of culturally tailored care. So there's also that reluctance among COLD communities to enter residential or nursing care, with most of the care being undertaken by family members in the community. So we've developed comprehensive goal-orientated wellbeing plans with our customers so that we can evaluate and revise them at least annually, often more often, to help achieve their outcomes and their wellbeing goals. We've conducted wellbeing calls to the majority of our customers, for example, and driven additional supports. So meals, additional services, virtual offerings to help people, particularly through our COVID-19 response. 70% of our customers have actually already upgraded to wellbeing plans from their previous care plans, which shows you the appetite for that increased service. We're also ensuring that spouses are supported through MAC assessments if additional needs are detected. And we're also supporting communities in need to ensure carers and customers have culturally appropriate supports. So throughout Australian Unity's 180-year history, we've supported Australians through times of war, financial upheaval, natural disasters, as well as the recovery and rebuilding of efforts that have followed, shattering events. So COVID has certainly brought its own set of unique challenges, but our response traditionally remains the same. Carers, compared to non-caregivers, more often felt depressed and anxious as a consequence of the pandemic. This finding was even more pronounced for parental caregivers who had increased their caregiving activities since the outbreak of the pandemic. In this population, nearly 30% of parental caregivers indicated feelings of depression more frequently, and nearly 40% indicated feeling anxious. So from the onset of COVID-19 pandemic, we've responded comprehensively and supported the wellbeing of our customers, employees, and the broader community. Our efforts to date have resulted in the minimisation of the worst of the human and financial impacts caused by the pandemic, with the aim of returning some positivity to the caregivers. So good mental health is vital to our wellbeing, and at Australian Unity, wellbeing is certainly at the heart of everything we do and is core to our purpose. So 20 years ago, we conceptualised the idea of a national index of wellbeing that could be used to track the social progress in Australia. And the past 2 decades, Australian Unity Wellbeing Index has tracked how satisfied Australians are across 7 domains, which include health, relationships, and community connectiveness. Personal wellbeing in Australia has remained relatively stable over this period, and we believe that this is due to 2 primary reasons. Firstly, we live in a good community, fundamentally good civil society that looks after its citizens, provides health and other services, and financial support to those in need. And the other factor is that people generally bounce back from the challenges. We tend to bounce back to a rough set point for wellbeing after we experience highs and lows, and we're witnessing that now. So, in closing, Australian Unity is a company that's founded on social values and community contribution, and we remain committed to building and promoting positive mental health strategies. So established in 1840 as a response to that unmet customer and community need, Australian Unity will continue to identify and help solve those health and financial needs of the broader community. And the Mental Health Month is an important opportunity to raise awareness about the impacts of mental ill health and the range of supports available that can really improve someone's sense of well-being. And we will continue to develop and continue to innovate new ways for people to access and receive effective treatments that work to alleviate their mental health symptoms. Thank you.
Thank you, Nick, for sharing a bit about the work that you do at Australian Unity. And thank you to Australian Unity for supporting MHFA. Certainly a lot of the anecdotes that you provided about the culturally and linguistically diverse communities probably not accessing the supports they need as much rings true. It's certainly the feedback that I get in the Multicultural Ambassador Program, and certainly one of the objectives that we have in breaking that stigma down. So thank you very much for sharing how your organisation supports the CALD communities. We've got now another special guest with us, Mr. Jim Beer, who is an experienced and very valued support group facilitator at the Foundation. He runs the Obsessive Compulsive Disorder Support Group. Jim is dedicated to mental health issues, and he has tremendous experience with many of the problems faced by those diagnosed with a mental illness. Jim's here today to share his lived experience. Thanks so much for joining us, Jim.
Thank you so much for having me. It's a privilege to be part of this and a part of the Mental Health Foundation. Once again, I can't be overstated. Respect the traditional owners of the land and elders past, present, future. I thank you for being here. I run the OCD support group at the Mental Health Foundation. I'm also a peer worker at Dandenong. I work with youth. I myself suffer from OCD. Also, part of my background, I wanted to mention, I actually studied under Greg Murray quite a few years ago at Swinburne University, where I wanted to be a psychologist at the time, but my mental health got in the way, as mental health gets in the way of a lot of things, and it's important to acknowledge that. The multicultural aspect, I came here to Australia when I was about 10 years old. Not long after, I developed OCD, a lot of abuse at home too. So I have, unfortunately, I wish I didn't, but I have a fair amount of experience with trauma from my own lived experience. From my another thing to mention just about multicultural groups, sometimes, as my mother didn't when she first came here, didn't really know her rights, for one thing. Was quite ignorant of what she could, the support that she could get in Australia. So these are quite complicated issues, and they're not simple, they're layered as well. What I wanted to also say is, so my mental health, I have been a carer at times, and my mental health has impacted others. So we all, no man is an island. We all impact on each other when it comes to mental health. And what I wanted to sort of add to this is also, through my work and over time, I realized what Greg Murray was talking about, which is about taking care of yourself as well. These days, and I've always been a bit of a socialist, I believe in a win-win situation where we're all getting a slice of the pie, so that you don't lose yourself in your caring role, and you don't lose yourself in a victim role either, as someone who does have a mental illness. And what I've learned, and I remember one of my meditation teachers in the last few years has mentioned something about compassionate boundaries, which had never occurred to me, that you can have boundaries and have them with compassion. One thing I see lacking in my work and even in the mental health system sometimes is just a lack of compassion and openness to respect people and tell them why we need to do things and why the system is the way it is, and an openness about the flaws, the pros and cons of our mental health system. Another thing I just want to add quickly, without waffling on too long, is one of the big things I do with youth. Now, we have a lot of people who talk about mental health and symptoms of mental health. What I often talk about is compassion and self-compassion. But I've noticed across the board, anyone who has a mental illness quite bitterly hates themselves for no reason except the fact that they have a mental illness and can't live up to the expectations of society and their own expectations. So one big thing I talk about where I work is about self-compassion, which is, and I want to make this distinction, it's not it's not the same as self-esteem. Self-esteem requires a comparison. Unfortunately, in this society, as soon as you hit kindergarten, you're being compared. It's always competition. Self-compassion requires no competition. There is no relative. It's compassion and dignity for everyone. Sinner or saint, good or bad, rich or poor. And that's something I've learned through meditation and spirituality. And I urge anyone to consider throwing medication and meditation into your bag of tricks. The more things you have in your bag of tricks, the better chances you're going to give yourself. One thing that I've found for me with meditation is it takes a long time, and up to 50 years, to realize you're not the contents of your mind. The contents of your mind will always come and go, up and down, back and forth, past, future. The problem is we're too identified with everything that goes on in our mind, and too much in the analytical brain. I may be going off topic, but I think it's an important one. And from there comes self-compassion. Realize actually your mind is just doing its thing. And if you're in a society that believes and has certain expectations, you'll internalize it. We often talk about stigma. There may be a lot of stigma about mental health, but I assure you self-stigma is far more damaging, what you actually believe. The ignorant, well, I'm going to say rubbish that you actually internalize and then impose on yourself your whole life. And again, self-compassion. I'll leave that at that. I hope I've hit the mark with something there. Thank you very much for the opportunity to be here.
Thanks, Jim. That was really powerful for you to share both your lived experience, but also your insights about mental illness. And I think what you're telling us is that the important starting point is to show kindness to yourself in the way that you would to other people, and really to allow your mind to have, take a creative license and not take your mind and your thoughts too seriously, because we aren't our thoughts. And I think that's certainly one thing that I've learned through my engagement with many experts like yourself about mental illness. So thank you. And I think the best thing we can do is encourage more people to share their lived experiences and support others through that process, because it does, you are able to demonstrate empathy because you've lived it. So thank you. It's a brave thing to do, but thank you for your time and for your commitment to MHFA and the people that you support.
Thank you for having me.
I want to now talk to you a bit about National Mental Health Month. And the foundation is very committed to this cause. And before COVID, we used to do a walk every year towards the end of October. And last year was our first year doing it virtually. And this year we will be doing it virtually again. Let's watch a small clip now about the walk and the mental health appeal.
Over 400 young people lose their lives to suicide each year. This number is 400 too many. This year, the Mhfa is launching the Mental Health Appeal on the 10th of October, raising funds to develop an evidence-based training program primarily aimed at promoting life and safety in young people. Join us this October in the fight against suicide. Your dollars and cents will help us prevent. Visit our website for more information on how you can support this cause. We're counting on you, Australia. Australia, are you ready for a challenge, and that too for a good cause? Then look no further. Join the Mhfa as we walk for mental health across the country on the 17th of October at 10:30 a.m. in each state and territory capital. Worried about COVID? Well, we've got you covered. We have launched our Mhfa app where you can walk virtually, raising funds as an individual or in a team. Visit our website for more information about getting started. So come on, Australia, our journey to better mental health starts with one step.
It'd be wonderful if everybody could head over to the Foundation's website, mhfa.org.au, for more information about the mental health appeal and in particular the walk. I do hope for your support and participation. And together, I think we can really make a remarkable impact on the mental health conversation. The mental health appeal was launched on the 10th of October and it coincides with World Mental Health Day. So we continue to take donations to help develop the prevention of youth suicide and a youth suicide prevention course, and I hope that you can support us. Moving along the agenda for today, we do have a recorded address from one of our sponsors, Mr. Bruce Wong, CEO of Foot Solutions. Let's watch him on our screens now.
Mental Health Foundation Australia is an organisation committed to improving the mental well-being of all Australians. Food Solutions' vision and value are very aligned with Mental Health Foundation Australia, and we have been supporting this charitable organisation for over 2 years now through various programs. We have been very involved in the meal delivery initiative organised by the foundation, which was a huge success last year and has continued this year with over 85,000 meals delivered so far. Food Solutions is honoured to be involved in the National Mental Health Month awareness campaign run by the foundation, which brings the Australian community together to raise awareness, stand the stigma, and initiate conversation about better mental health and importance of mental well-being, which is required now more than ever. And one thing we can thank the pandemic for is bringing mental health to the forefront, creating the opportunity for more open discussion to be had, furthering the breaking down of stigma and the opportunity to really look at what is required in the mental health space. Another thing we can thank the pandemic for is platforms like Zoom, which help bring us all together in such a wonderful way. This year, the foundation is launching for the first time the Mental Health Appeal on the 10th of October to raise funds to develop a program to educate the community in a hope to prevent youth suicide. I commend the important work Mental Health Foundation Australia is doing in the Australian community, especially within the multicultural cohort. My best wishes and appreciation to Hassan and Jim for providing excellent leadership and direction to this organization. Food Solutions will continue to be involved with the Mental Health Foundation Australia and its initiative in improving the mental health of all Australians. I encourage you all to interact with more events during National Mental Health Month, which you can find out more about their website. www.mhfa.org.au. And thank you and enjoy the rest of the event.
Thanks so much, Bruce, for your support, especially towards the Meal Delivery Initiative. I'd now like to invite our next very esteemed guest, Ms. Sonia de Mhfa, for an address before we move on to a panel discussion. Sonia is a human rights lawyer, solicitor, and the CEO of the Loddon Campaspe Multicultural Services in Bendigo, Victoria. Sonia speaks 5 languages, is a solicitor, and holds a Master of International Law, majoring in human rights. Sonia has set up and managed human rights projects in Pakistan and Sudan, worked for the United Nations High Commissioner for Refugees in Lebanon, worked for a child labour rights NGO in India, and as a refugee lawyer in Australia. She sits on the boards of 2 international human rights NGOs and an Australian mental health focused NGO, Grow Australia. She was a carer representative of the Mental Health in Multicultural Australia Consumers and Carers Group, auspiced by Mental Health Australia from 2014 to 2018. That's a very long list of accolades, and I'm sure that there's many more that we haven't got time to list here, Sonia. Thank you so much for taking time out of your day to be with us today, in spite of your very busy schedule.
Thank you very much for that introduction. I'd also like to acknowledge the traditional owners of the land upon which we meet today. Here in Bendigo, it's the Dja Dja Wurrung, and all the other traditional owners, and pay my respects to their elders past, present and emerging. It's wonderful to be with you all here today. As we know, during these pandemic times have been extremely challenging for all concerned. Constant unknowns about what's coming next, lockdowns, social isolation, regulations that we have to follow to keep everyone in the community safe. And this is having an impact on everyone's mental health. It's something that affects us all, mental health. If there's anything that the pandemic has shown the community, it's that this is an issue that affects everyone in the community, no matter where you're from, not just a specific group of people. We all get physically sick, whether it's from a cold or from a more serious ailment. It's the same with mental health. We all have our good days and days when we feel down, depressed, or anxious. If the people we care about are suffering low mental health times in their lives, this can be even more difficult for the carers of people with mental ill health. This is compounded even more if you come from a culturally diverse background. In many cultures, mental health carries a stigma with it. Talking about mental health issues can be frowned upon. And it's just expected that if you're a carer, you just get on with it, and that's what your role is. Religious beliefs and cultural practices can view mental health being a consequence of a person or their family being bad or sinning. This can make it very complex to talk about the issue and even reach out for help. In some countries, talking about mental health is greatly frowned upon. So how can you get through your own mental health issues if your culture is against you even talking about it? The most important thing when you are facing mental health challenges is to reach out for help. Social isolation, particularly that compounded by COVID-19, can make this really hard. If you're caring for someone and struggling yourself, it's important that you get the help you need. You can do a search on the internet for such organisations like Lifeline or Beyond Blue that can provide supports. And you can also talk to your doctor to ask if they can provide you with a mental health plan of subsidised counselling sessions from someone who can help you. Some people might struggle with using the internet. We presume that everyone knows how to use it. In some multicultural communities, we've found people may have had their education interrupted or stopped because of their economic circumstances or conflict in their countries of origin. People might also struggle with illiteracy, being able to read or write for the same reason. So for this reason, if you or someone you know needs help and struggles with speaking English, you can request the assistance of a telephone interpreter to help you get the support you need. There are a lot of translated resources about mental health and supports on the internet, which are also easily accessible. Coming from a culturally diverse background can present its own challenges. There are many resources out there from the organisations I've mentioned, and they can help point you in the right direction. And of course, Mhfa can help too by pointing you in the right direction of where you can get some help. I believe we're all going to get through this COVID-19 pandemic together, but it's not going to come without its challenges, and we won't be able to do it alone. Social isolation is the biggest challenge to good mental health for carers and for people who experience mental ill health. Our focus should be on reducing this to the greatest extent possible and helping those to access the supports they might need. So if you know someone who's a carer or someone who's just struggling in these hard times, reach out, speak to them, let them know you care. I'm convinced we can do this together if we look out for each other and if we care for each other and help guide people to where they can get the help and support they might need. Thank you very much for listening.
Thanks so much, Sonia, for sharing those insights and some really pragmatic tips that we can all use and remind ourselves that there's so many carers in our community that we can probably reach out to and check in on. So thank you for a very timely and important reminder.
Thank you, Harry.
I now want to move on to our panel discussion for today, and I'd like to invite Jim Gooden back to moderate the panel discussion.
Oh, thank you very much, Haria. Yes, a wonderful list of presentations there from all our presenters, and I've been furiously taking notes. So many issues that have been raised. We have an hour with this panel, theoretically. I'm not sure whether we can use all that time. However, we will certainly be addressing a lot of those questions that and issues that were raised. So just to our viewers, the panel will be taking questions from our personal view, our virtual viewers, yourselves. Please use the Q&A function to ask your questions if you have any particular questions you want to ask. We may not be able to answer them all, but we'll give it a good try. If you wish to address your question to a particular panelist, please make that clear in your question. Sonia, very impressed with your talk, and even perhaps more impressed with the fact that you speak 5 languages. That is absolutely remarkable, and what a wonderful advertisement you are for multiculturalism. And
thank you, Jim.
You're absolutely welcome. I'm really honoured and thrilled to have such wonderful people on our panel, and we'll of course hear from all of them in turn. Sonia, I'd like to address my first question to you, but the other panelists, please feel free to add your own insights and experiences at any time during the questions raised. Sonia, as CEO of Loddon Compasby Multicultural Services, you have raised this to a certain extent. Are carers from culturally and linguistic diverse backgrounds subject to special difficulties not experienced by the general population? I know you've dealt with some of them. Are there any others that you could list there? That's the first part of my question.
Okay,
then,
well, yeah, sorry. And your second question. Sorry, Jim.
Well, if you'd rather answer the first part, that's okay.
I think there are always 2 big obstacles in this mental health space with people from multicultural backgrounds, and that's the language challenge. So being able to receive information, understand information, and also our culture. Now, these 2 things are really wonderful elements of diversity. It causes for celebration, but they can also be causes for challenges. So in Australia, I think we've got really high awareness of mental ill health and the issues relating to it, especially during the pandemic. But we take that for granted, and that is not always the case in countries of origin. So, you know, I come from an Italian-Australian background. My parents were Italian, and I was born in Australia, so I'm intergenerational count. And, you know, I know in our family, it was not something that could be openly talked about if someone had a mental ill health issue. And that can be really difficult. And the only way we can overcome that is through providing information, awareness, providing supports in a culturally safe way that's not confronting and in a language that people can understand.
And I imagine for many new arrivals to this country, just the trauma of leaving the old country and trying to reintegrate into the Australian community must be so difficult in itself. That in itself could be the source of a mental illness or mental distress.
Absolutely. There can be great layers of complexity. So we're all experiencing the mental health challenges of the pandemic. But if you come to a new country and the culture is so alien to what you're used to, that can also lead to anxiety and depression and what is known in the research as culture shock. So that is very much a significant issue.
Are there any particular patterns as to who are the major caregivers in culturally diverse communities in your experience?
Well, you see common denominators of what happened traditionally. Now, things, for example, in my own culture, in Italy, things have changed. But traditionally, across many cultures, people would look after their elderly parents, for example, in their home. Now, the reality of Australia is both parents have to work. And a lot of people do not have the skills to look after an elderly person 24 hours a day. It causes carer fatigue and burnout and is really challenging and can create mental ill health. But there can be an expectation that if, for example, you're a woman and you're the eldest daughter or one of the daughters, that is the role that you have to take. That's what used to happen in Italy like 50, 70 years ago. Probably not as much these days, but it's also common across many other cultures I've interacted with.
I was wondering about that, and of course we'll get through to the role of women carers in particular a little later on during this Q&A session. And my final question for you, well, this round of questions, are there particular difficulties faced by carers in rural and provincial areas? Because you're from Loddon Campaspe, so
Absolutely.
it's not a city area. It's regional, provincial.
There are special nuances and challenges faced in the regional areas. I originate from Sydney. I lived most of my childhood there, and I spent the last 10 years in Canberra. I've just moved here 10 months ago. The Loddon Campaspe region, Bendigo, is predominantly Anglo-Caucasian. 25% of Australia and Canberra and Sydney roughly are born overseas. In Bendigo, it's 10%. And there are 3 main refugee groups, and there's a smattering of migrant groups. So that can make you feel even more alienated where your community is not there. Also, regional areas in general get less services and supports. That is a challenge throughout Australia for multicultural communities and for Anglo-Australian communities as well. So that compounds it.
Thank you, Sonia. I think you've got a lot to contribute, and obviously we'll come back to you.
Thank you, Jim.
Pushpa, as leader of the Queensland Multicultural Ambassadors, I know that the focus of your work is on liberating human workplace potential, especially. I know you do many other things. However, focusing on that, is the capacity of the carer in the workplace diminished because of the caring duties they may have for a family member at home? And do you have any examples of this? Hello, Pushpa?
There you go. Can you hear me now?
Yes. Did you hear the question?
Yes, absolutely. Yes, thank you, Jim. I just want to say that the event so far has been phenomenal, and definitely growing crucial arena. So yes, there are different avenues for carers in the workplace. They perceive it in different ways. For many carers, some carers, they see it as a break for themselves, where they get an opportunity to just have time to relax and rejuvenate before they go back into that home or personal environment where they are looking after loved ones or caring for somebody. And for many, it really does impact the work toll that they're actually performing in. So we as individuals and human beings go through thousands of thoughts throughout the day. And a lot of these carers, if they don't have access to support for themselves, are carrying these adverse thoughts within themselves, and that they're reliving whatever they're doing outside of the work environment while they're performing the tasks as well. The other thing that we've really found common when we've gone into the working environments is that they've become overly sensitive and very vulnerable in the fact that if there's a normal colleague, doing something that's just a day-to-day activity, some of them feel that is targeted to them. So they become really sensitive in the fact that it compromises their ability and their self-awareness, their self-love, and their self-respect. For many carers, they don't realize that it's actually impacting them emotionally, mentally, physically. And why I say physically is that they sort of tend to stop looking after themselves as they would have if it were a normal day for them. As in that, their diet is it's reduced, or they're not eating as well as they should be. There's a lack of exercise, the constant worry and the strain, and that in itself, when they're living in a negative emotion or thought process, is draining their energy, irrelevant of whatever they're doing outside or what they're doing in the work environment. And when you ask for examples, so about a month ago, I actually heard of a friend that was working in the mental health arena that took his life, and he was a very young person, but he was obviously going through his own dilemma of looking after a child. I had 2 women last week that were going through severe burnout, and the burnout wasn't job related because their work was really easy and they absolutely loved the work. For one of them, because she took on that role of a carer, she didn't realize how much time or how much energy it was going to cost her. And the burnout literally happened because she was spending like over 10 hours at home looking after the person that she was caring for. And then at work, not focusing on the work, but really just thinking about what else can I do for my loved one? What else can I do outside of the norm? And one of the other commonalities we found is that carers usually in their work environment are reaching out and feel that, you know, they should be heard or they should be listened to. And if they're having a dinner break, they're talking about their personal situation, whereas other work colleagues are not wanting to listen or don't have the ability to really listen or comprehend, which they do have the ability to listen, but they don't know if they're doing the right thing. So yes, it has diminished a lot, especially I found in the education arena. We've done some work with a couple of training organizations, and even more so with the children, so students that have got part-time jobs. As Sonia mentioned, you know, we've got a lot of migrant students here that are doing work in addition to their studies, and the strains of COVID hitting them has led to numerous suicides. I heard of one boy that had recently just burnt himself. So yeah, they are neglecting themselves without realizing, and when the realization does hit, it's usually a little too late and they really truly need that support. So one of the things that I would say is that providing our carers, you know, the minute they say, yes, we can care or we are looking after, you know, providing them that additional support, that additional counseling or listening or giving them the opportunity to reach out. I just wanted to share one other thing was that we've had carers that have been looking after their loved ones or people that they know for a very long time, who have then been, you know, granted a home, a 24/7 hour care facility. This has had an adverse effect on the carer that has now separated from that individual, and they're getting withdrawal symptoms. And that's, you know, that's a really huge thing that's happening right now, because I do some work through the NDIS with some clients, and I believe the carers also need support if, you know, if that happens, or, you know, if there's a separation from the person that they're caring for, whether it is through professional help or whether it is through, unfortunately, death, they still continue to need that support, because it's that sense of responsibility and their thinking and their thoughts behind their ability to respond to the situation.
Thank you, Pushka. That's an amazing level of experience, and quite clearly, I'm very glad this has been recorded so that we'll have this for posterity and to be able to replay for people. You're clearly a wealth of information on this topic, and thank you very much for being part of this panel. And obviously, we'll get back to you, I'm sure.
Thank you.
Matthew Dale, you are Vice President of the Bipolar Life and facilitate a bipolar carers support group in conjunction with the Mental Health Foundation Australia and Bipolar Life. Now, there is an interesting story about Matt. I had a wonderful conversation with someone who I thought was Matt 2 years ago or 3 years ago at the Royal Melbourne show. Now, I did think it was Matt, and I was talking to him about all sorts of bipolar issues, etc. And then I realised, no, it wasn't actually Matt, and I was talking to a complete and utter stranger. So I just want to let you know that we can make some very embarrassing mistakes at times. Matt, what sorts of stresses and strains for carers have you become aware of through your experience, your extensive experience in dealing with bipolar illness and also running the support group?
Yeah, thanks, Jim. And that must have been my twin brother you ran into, possibly.
I think we resolved it as that, didn't we? I think we just
at least someone had a good conversation with you.
Yeah.
But
yes,
Yeah, so I've been running the Bipolar Care Support Group since February this year, and we've only had one face-to-face meeting, unfortunately, here in Melbourne, the lockdown capital, but
Yes.
it's good to know we'll be out of that soon. We're all heading in the right direction, but prior to my work with Mind Australia, I worked in a carer's capacity as a support worker as well. And I think not only supporting people that had a loved one who had bipolar, but all kinds of conditions such as schizophrenia or personality disorders, etc. There are many challenges for people where their loved one might have been suicidal or just really struggling with their mental health. So that would often potentially impact on their own mental health. And statistically, it's like a couple of people said, it's very high, like it's as high as 50% of carers will experience depression or anxiety themselves as a result of their caring responsibilities. And it's so important that carers do look after themselves first, because it's so important, like they say, like on an aeroplane, that's, you know, if the oxygen mask drops down, that you put it, a parent puts it on themselves before they apply it to the child and that sort of thing, because the same goes for a carer. If the carer is not looking after their own well-being and mental health, then they can't be of you know, good service or help to their loved one as well. So it's important.
That's a very good analogy, isn't it? I think, you know, the aeroplane oxygen mask coming down, and look after yourself first, otherwise you're not good to anyone, literally.
But to know in some of the work, sometimes some carers, they see themselves first and foremost as, you know, that parent or the child who's looking after their parents who has a mental illness. But at the end of the day, they are actually doing a caring role and saving the Australian government millions of dollars each year. And there's times when, I know one particular case, I told this story at the last Bipolar Carers Support Group, that the man who had mental illness in his early 30s, the mum would forever be rescuing him. He had a dual diagnosis of drug and alcohol as well. And whenever something went wrong in things he was doing, she'd always be there to rescue him and try and save him. But in a way, she wasn't empowering him at all. She was better to let him learn, just like for all of us, to learn from our mistakes.
Well, maybe she was in fact enabling him, because she was providing a safety net at a time when maybe he wasn't experiencing the consequences of his actions, and that might have been more therapeutic for him.
So, and sometimes that can set up that codependency as well. So it was important that she stepped away a bit. And actually, again, another thing too, that carers often, they'll put their life on hold waiting for things to improve in their life, but they can actually be a very positive role model for the person they're caring for by doing, you know, catching up with friends or doing their hobbies and interests. And by the person that's got the lived experience of mental illness, they can see, oh, mum and dad are, you know, still, of course, they're still doing the caring role, but catching up with friends and doing the things that they enjoy doing, that might actually encourage them to maybe start attempting to do things, even though they might be really doing it hard with their own mental health.
Wonderful. Thank you, Matt. And once again, an enormous wealth of experience that you bring to the forum, and I thank you for it. Jim, I better say Jim Beer, otherwise people will confuse the two of us. We're fortunate enough to share the same name, which we both like. However, we do get a bit confused with it. Jim, you raised a very interesting and I think essential point of compassionate boundaries, of how important they are. And even though we may, or carers may, wish to please the person we're caring for, because very often it's someone that we may have some emotional affection to, or even love, particularly if it's a child. how much is there a danger in pandering to those wishes? And I think about the concept of enabling, letting them get away with too much and not providing some obstacles. The previous chairperson of the Mental Health Foundation, who I've mentioned earlier on, Professor Graham Burrows, always had a little adage that he used to whisper in my ear, and he used to say, Jim, if we want to make people change, we need to make them a little bit uncomfortable. We don't want to make them too comfortable sitting or being where they are. Then there has to be some sort of incentive to make people change. So what's your view about that sort of statement?
No, I think it's a very good statement, Jim. Good, and I actually use the same thing at work. When the kids come in, I often say, if you come in here and have a great old time and treat it like a school camp, you've probably done nothing. So you need to be a little bit uncomfortable. Being uncomfortable is very useful.
And you also say something to them, don't you? You also say, look, I'm not here to be your friend as such. Is that right?
Yeah, I'm not here to be your friend. I often want to break down the power dynamics. I'm not here to be your friend, but neither am I here just to be an expert and tell you what to do. And along those lines, what I've actually mentioned to my co-workers, one problem I find in mental health and in society in generally, sometimes it's just a matter of respect to tell people why we're doing something. And, we may say tough love and this and that and don't enable someone. But when I call someone out to do a group, what I do is I tell them why you need to do the group. You need to do the group for structure. I tell them from my own experience, I need structure. I need expectations.
Yes.
And contrary to popular belief, I'm not a big fan of responsibility and choice. Now, no one might like me saying that, but if life worked like that, no one would have a problem. We'd all take responsibility and make those choices that everyone thinks are so easy. Sometimes we need to be nudged. That's how life works. And I often say to the kids, we did 4 groups today. Why did you do 4 groups? Was it really choice? Or was it partly because it was an expectation? And again, coming to the same thing, for all of us, we wouldn't be here doing what we're doing if there wasn't some sense of expectation. Come on, buddy, get yourself ready, get in there. And so what I do with this thing, what I'm talking about compassionate boundaries, I'm talking about tell someone what they need to do and why.
And of course, the corollary of that is if you do, as a carer, absorb yourself completely in the concerns of the person you're caring for, you actually lose your own emotional equilibrium. And we know the old process that stress leads to anxiety, to depression. Your own mental health suffers enormously over time.
Yeah, your own mental health will definitely suffer enormously. Just to go on that, on a couple of things that were mentioned before as well. I remember seeing my mother when we first came to Australia. I assure you, she would have rather been at work than to be a carer at home. Being a carer is actually harder than having a job because also there's no validation. There's absolutely no validation. And in a society, our analytical brain loves to measure things in numbers. So you can't quite measure that. But if you go to work and you come back home, it's measured in dollars and cents. And of course, we all get a lot of acknowledgement and validation for that. But I assure you, for a lot of carers, and I could see in my mother's way, she would have been much better off out at work than it actually at home. So there's a whole lot of another thing just on that validation. I don't think as human beings we realize how important it is just to be witnessed. I see kids who come into where I work. We're very much about goal orientated. What skills we're going to learn, what skills, and I can see on their faces sometimes. Never mind the goals and the skills, just witness me. Just witness my existence.
Just witness my existence. And that's very close to what, of course, Greg Murray was saying about simply listening and not judging and being active in their treatment, of course. But being an empathetic listener, you well know as a support group facilitator, as would Matt, and in fact all our panel, is probably the #1 skill that you require to be an empathetic listener, to listen carefully.
Yeah, and open up a little bit about yourself. When I tell the kids about my need for structure and my need for discomfort, then they go, oh, right, okay. Now, so when you're rather than enabling someone, you could tell them, listen, buddy, this is what's required. I'm doing it for me. I'm doing it for you. And if I don't do it for you, tell them why. That's compassion. If I said to the kids, just come and do this group, we've got to do this group, then I come across as authoritative. It's disempowering. If I tell them why and how I need expectations and structure as well, then it suddenly becomes the same thing, becomes empowering. And that's
Jim,
what the recovery is about.
Jim, you also very appropriately raised your mother's experience when you came here at 10, and your mother, who I know a bit about yourself and your mother, and that your mother didn't know her rights, she didn't know where to get support, and she didn't have the language skills to be able to get that support, to seek it out. Have you got any further comments about that? Because that fits in very closely with what Sonia was talking about in particular.
Now she was English speaking. It wasn't so much the language in that sense, but she didn't have that that knowledge of how things work, how to go about things. She didn't know the rights she had. There's also this element that no one says it, and racism is very funny because it doesn't have to be as overt as we see. We you know, it's not just about calling people names. You feel sometimes when you come to Australia like you're a guest. How lucky are you to come to Australia? How lucky you come to Australia. So lo and behold, you have any complaints because you're lucky to be here, buddy. Don't complain. We took you in. There's this little element of racism going on in there that no one mentions.
Well, also an element of potential exploitation there, isn't there?
Yeah. So you feel disempowered. You feel, oh, I can't open my mouth. I can't do this. I can't do that. And there's all these, as again, the complex layers of all this sort of stuff. And also women from ethnic communities and whatnot do come from a bit of a submissive sort of environment, and they internalize the submission, so they don't think they can speak up. They don't think they should speak up. And what you need to do is get out, empower. Even the mental health system is empowering enough. The authoritative thing doesn't work, and what I find as a solution for my work with anything is when you break down some of the barriers and come across as an equal. Not I'm Australian and I've let you into my country. I'm lucky to be, we're all born in place and time. We all like to overlay what we did and how we own this and own that, but actually we're just born in place and time and doing our very best to survive. That's all we ever do. But the mind loves to put a layer of I this and I did that and I, which I think from a bit of an existential perspective is actually a bit of fiction that the mind loves. But when you break down that I, that we're part of a team, you actually empower people. You come to real equality. You know, you have every right that I have. Just because whether you're born here or not is irrelevant.
Good. Thank you very much for that, Jim. And once again, a wealth of expertise. Now, I have an issue that I want to pose to the entire panel, so please feel free to jump in. I have a very good friend whose daughter for many, many years was in and out of hospital for self-mutilation, quite severe self-mutilation, in fact. At the age of 18, this girl decided that her gender was not the correct gender and that she believed that she was a male in a female body. And of course, this is a problem of great significance at the moment with our young people, or at least it is according to our media. Now, the mother had a lot of information about the child's background, or when she was a child, and her many hospitalizations, etc. We heard the importance from Greg Murray, and in fact everybody here, and everything I've ever read about the importance of carers being involved in the therapy and the recovery process for young people, and providing information to clinicians. However, in this case, the mother was completely excluded. She wasn't allowed to provide any information. She wasn't allowed to provide any detail about the previous medical history. She wasn't allowed into any of the conversations, etc. Now, that's not the only example of this. In my experience, a major problem for carers is that clinicians, in their efforts to observe patient confidentiality, and we all know how important patient confidentiality is, they do not involve the family or friends, or may not involve the family or friends in the therapy or the exchange of information. Now, as I've said, confidentiality is vitally important, but no less so, as we've heard from our many different experts here, than recognising the importance of carers in the recovery journey. So how do we reconcile these two issues, that you have to respect confidentiality, but in some cases clinicians feel that they can't share that information, or they can't involve the carer, in this case a mother of an 18-year-old, in the discussions?
That's a really challenging one. And I'm not a medical practitioner or a therapeutic practitioner. I'm a lawyer. But just looking from a rights focused, it is very important that the person who's receiving the treatment or supports has their privacy and confidentiality respected. That's a human right of self-determination. Yes. But we must recognise that the carer who invests so much support and care and hours of, you know, love and being there without often being paid, also, you know, has a role to play. And I think it is that fine balance of recognising that confidentiality and privacy and everything must be respected, but communicating that to the carer and working out a role for them to play in the journey so that they are not disregarded or devalued or disrespected. You know, having a conversation with them and explaining these are the parameters. It's not about you. This is the Australian law, and I have to, as a professional, do this. But I do recognise that what you have to say, your observations and your input are very valuable. And, you know, let's take this journey while respecting that person's confidentiality. There's no easy solution to this. It's a tricky one, but I think we can achieve it if you speak to people respectfully and with dignity, and you value the role and the personage and the identity, as Jim was referring to, of the carer.
Yeah. And Sonia, that's such a valid point, is that, you know, we get the legal side of it done. And it's funny because I had a client last week that her daughter was going through bipolar and really, you know, going through a really hard time, not sleeping. She hadn't slept for like 3 or 4 days. And when she went to the therapist, like 2 therapy people refused to work with her. When she went to the 3rd one, the mother did call up and say, so how is she? How's everything going? And they didn't obviously disclose anything, but they told the daughter, oh, your mother did call. And this immediately caused a further conflict between the mother and the child. And we have to remember that whatever the individual is going through, sometimes what we as the carers, and because we're so close to them, we don't see what the triggers are or what's really going on beneath, you know, what's going on within them, what's going on in that barrel, which the therapy probably will use patterns or use, you know, sessions, use therapeutical practices to take that out. You know, they might even go on a transgressional journey and let's see what of the past was bringing in that triggers this emotion out. And it might be related to childhood bringing up, which the children sort of interpret in a different way to the way the parents interpret, and especially on a cultural side of things, because culturally, things we put into place is seen differently in a multicultural world with so much support for children. So children can either see it as great advice from the parents, or they can see it as a sense of bullying or an attack. And where I'm going with this is that, yes, the carers are so emotionally attached that they may not see what's beyond or what's best for that child. Hence, you know, they need that support and the explanation as to why it's important to keep that privacy, but also for the therapists to do the job. And the carers also need to sometimes just accept it in their heart that they're doing the best that they can for my child, and this is the best, you know, this is the greatest thing that's happening. And what we found the sensitivity more is when the parents don't understand what's triggering this perfect child that may have been fine until they were 10, 11 years old. And then it might be transgenerational things that are coming into place, and the parents can't understand it. And sometimes they think that if we just love them and we care for them, it's going to be enough. it is in certain instances, sometimes it is, but we really need a third body to come in so that they take the emotions out of it. And as Sonia said, to see it in a logical sense so that we can provide the best thing for that individual. And it really is just educating the carer in a loving way that they feel supported as well.
That's great. Can I just add one very important thing, Pushpa,
Please,
that
Sonia,
you just highlighted and this came to mind? The multicultural challenge is here in Australia, we very much promote and value the rights of the individual. But in many cultures, the rights of the community is more important. This actually caused an issue in my own family. The parents and the family have the right to know everything. Confidentiality is something very alien, number one, and the whole sense of hierarchy. In Australia, we don't have hierarchy as much as many other cultures. We're quite flat. In many cultures, the parents have more respect and decisions are made by the parents, no matter what age they are.
Yeah.
So these are the hard things to understand in Australia. Absolutely, Pushpa. I completely agree with your approach about loving and caring, but there might be things where it's important that the carer doesn't know if it's something that's tied up in the past. Sorry, Jim, just want to jump in.
Can I throw in something as well, Jim Good? Can I throw in something as well?
Oh, Jim, please. Yes.
Because I suffer from oppositional personality disorder. I'm just going to put the other side in. Okay, the other side, because of course I agree with you guys, and you need to have boundaries and confidentiality. But I can also say this, and this is partly because I didn't become a psychologist, but a peer worker. I can see that in the system and in Australia, if you have a piece of paper, if you have the idea of, if you're dressed like a professional, you can use that as leverage as well. But you can use that as ways of keeping people out. That I'm the expert. I've got my degree. Doesn't matter that I'm 24 years old, but I've got a piece of paper and I know more than you know. And I really feel very strongly about it. I can see the games that are played on both sides.
And
that's weaponized. That's true.
That's a very, very valid point. And I think we're hopefully slowly moving away from that model, where, of course, you know, the lived experience of carers is valued, I won't say as much necessarily as the professional or clinical experience, but it's certainly been given all sorts of weight, and we see that in various pieces of legislation and changes to mental health acts, not only here in Victoria, but across Australia. So we see that coming through, that there's an expertise that consumers are assumed to have by virtue of their experience.
I'm just going to throw this in, okay? And this has been a big learning thing in my life, that I could do a PhD on love and compassion and not have an ounce of it in my body. Yet my grandmother, who never went to school, could have an abundance of it. And gets no, and of course I get all the credit for my hard work in my PhD, even though I hate myself and everyone around me.
There have been, just getting back to a very practical level, there have been some suggestions as to how we can ensure that carers become part of the partnership and fully appreciated and recognised in the recovery of patients. But it still doesn't really address the issue of patient confidentiality. I know Professor Alan Fels suggested a whole model, but I won't go into the details of it now. But it still needed confidential information to be put on a sheet, but it was basically an agreement, a contract between carer and consumer as to what information would be shared and what information wouldn't be shared, which of course is a very delicate balancing act. But I just want to put that forward, that this is an issue that is being addressed. Whether we're going to find the right balance in the near future or 50 years' time, who knows? But I think slowly we're working towards it. But it is one of the major issues, I think, that carers confront at the moment in their wish to help their loved one to recover.
Yeah, and I'll just add on to that. Thank you, Jim, for your contribution. That usually the loved ones feel that, especially in the multicultural, and Sonia will probably agree with this, is that they feel that they're going to be judged or opinionated. You know, we've had somebody that's had anorexia and somebody that was bulimic, and for her, it was such an embarrassment that for most of her life, what she had done was whatever was being fed, she took it out, and then she was eating again, and then she was eating again. And she knows that if her parents found that out, they would, really be hurt and angry, and she didn't want to disclose that. So that's, who's going to judge me? It comes back to the stigma again. It's either going to be my father that's going to blame my mother for my behavior, or somebody outside of my environment is saying that it's because you did this, that's why she's become like that.
Yes.
Yeah.
And now this raises an interesting question. I think particularly Pushpa and Sonia will be equipped to address this. And I raise it, as of September 2020, carer payments or payments to carers of people with psychological or psychiatric conditions was 28% of all carer payments. So, nearly 30%, a third, it's rounded up, of all carer payments. Nearly 60% of those payments were received for care of children under the age of 16. That means that parents, predominantly younger to middle-aged women in particular, who are the chief recipients of those carer payments, were really bound up during their most productive career years. Is there a remedy to this? I can think of some, obviously, but is there a remedy to this? It raises issues of the mental health epidemic currently in young people, and also the stresses and the demands and the expectations on women and mothers in particular. Do we have any comments about that? Seems a bit innocuous.
Yes. So Jim, when you're saying is that they received the payments when the children were at a very young age to care for the child.
That's right. It's following on. There is an expectation that women will do the work,
yes,
and sacrifice their careers. And what I presented to you, and I'm sorry it's a bit complicated, but it's actually evidence that that does happen according to the carer payments.
Absolutely. And there has to be greater financial support and also mental health support on everything that we're talking about today. But there must be greater financial support. And also just Jim Beer touched on this before, that, carers have an identity too. They're not just a carer, they're
and ambition.
For someone.
And
and
ambition.
an ambition and dreams and careers. And so, by doing this caring work, in many ways, they put themselves, on the back burner, and their hopes and aspirations are secondary to other people's. So and I think there was some funding that came out, a grant of funding about helping carers to get back into the employment cycle. And I'm seeing a lot of comments in the chat about people having to dip into their superannuation.
Yes.
It's been so challenging. So I think what you're touching on is not just the financial support, but the need to recognise the identity of a person who has one role as a carer, but also what they would like to do and the things that they would like to do in life and in their career. And sometimes there's a choice to be a carer, and that should be valued. And there's also sometimes people feel compelled, and that might not be something they want to do, or that they struggle with. And there should be support on many levels, including financial, for people who do take on that role.
And Sonia, that's just such a beautiful point that you've raised there, that it's like when a couple goes through separation, because it's usually the woman that sacrificed her career and her ambition and just to be looking after that child, and then to do it in addition to be caring for somebody. Even, the financial help would be great, but if there was something like a program which would help them do that, follow their ambition as well, part-time, or is there something that they can do outside of that? So I raised this when I first talked about what the impacts in the work. And many people, like ladies that go to work, for them it's a relief. You know, they're getting a break and they're following their personal passion, which puts them in a really great place emotionally, mentally, to go back and, you know, work with their loved ones at home. So there can be a balance created. It doesn't always have to be sacrifice. And if there was something in place to say, okay, how about you know, do you want to do some voluntary work, or do you want to work part-time? And today is a digital age. Today is about technology. Anything and everything is possible. I mean, we're reaching people globally and helping them on mental health. So it's so easy. It's not so expensive. And plus, what you're doing is contributing to somebody's life that's probably going to avoid them having a breakdown or a burnout or, you know, an emotional trauma.
Can I raise another issue which is around that? And Anthony Carbines raised the issue of the money that's going out, and he did say that over a 4-year period, $50 million was being spent on carer strategies for carer respite. And it did strike me, I think that was only in Victoria alone, and it did strike me, that's really not very much money in the scheme of things. I don't mean to be critical of our speakers, and I don't mean any disrespect to Anthony as a politician or government servant or servant of the people more particular, but he spoke about improved funding, which was 2.5 million for self-care packs and state grants that were 1 million. These are very small amounts, really, being distributed amongst carers, given the need. And we had many of our audience participants saying, well, I've never heard of these things and I would like to access some of this stuff. But really, there's not much stuff to access, is there?
And, you know, if you take into consideration our population, it's minute. It's, what is it, 50 cents per person? Yep. And as in the current state that we're in, everybody has been impacted one way, shape, and, you know, they've been impacted physically, emotionally, socially, and we don't even know it yet. But the breakdown is going to come. It's going to be huge next year when people have that realization.
Yes. So the penultimate question here is, are there any interesting developments or suggestions as to how we can improve respite care, give our carers much needed break? Do any of you have any information, for example, about the effectiveness of carer respite services under the National Disability Insurance Scheme? Any comments about that?
They have made changes to that, Jim, so there is more money, because I think it used to be referred to as short breaks or holidays for the person. So there is more money, my understanding is, that's been put into the NDIS for, but it depends on the package that the person's got, because some people, the NDIS is making it a lot harder to access.
Yes.
For starters, and the packages might not be as large as well. So there is more opportunities for people, but it's important that people access, depending where people are coming from today, but like Carers Victoria or Carers Australia, there is other respite options, and places like Wellways, they even have a house that people can go to for free down in Gippsland. So there are respite options, but yeah.
It does. I read most recently the latest NDIS report available from 2020, and there does seem to be an increase in the money made available to respite care, but it is a very gradual, incremental increase. I was just wondering if anyone had any comments about that. Is it enough? Is it enough? Are we doing it fast enough, or does it need to be sped up? Is this a vastly underrated area, the care and the consideration that we give to our voluntary carers, our informal carers, however you wish to describe it?
Absolutely. I mean, I'm not doing as much work in the NDIS space as I did in Canberra, but I will say I've represented many clients with advocacy the carers were just completely burnt out. And I do think that there needs to be more funding and more focus in this area because, you know, they are really carrying the economy in many ways, and we can't take them for granted.
No, we cannot. We cannot. We can't take any goodwill or progress in this battle, I always regard it as, that we're all engaged in towards improving the community mental health. Look, I have one final question for Jim Beer, but basically I'm going to end the discussion before I raise this question with Jim Beer, but just to show how very, very well informed our panel is with a whole range of issues. Jim, I have a final question for you, if you don't mind me asking. Jim, who won the English Football Cup in 1949?
Well, oddly enough, Jim, that's one I do know because I'm well educated, as you know. It was Wolverhampton Wanderers. They beat Leicester City 3-1, believe it or not.
Right, and how many wins was that for the Wolves?
That was their 4th win, Jim.
Look, you're amazing. You're amazing, Jim Beer. Look, any question that I've thrown at this panel, they've been so absolutely wonderful in their capacity to answer. And I guess my reason for throwing that question in is that the use of humour and a little foolishness can help relieve the stress placed upon carers at times. So Jim Beer and I thought we would introduce a little folly to end the session. So I would very much like to thank you all for your participation. And I think all the comments have been like gold, absolutely marvellous. I'll pass back to you, our wonderful MC.
Thanks, Jim. And thank you to all our panelists for joining us today and for all the guest speakers as well for giving us their address. I also took notes as everybody was speaking, and some of the takeaway points from me, in particular from Professor Greg Murray, were that that carers need to educate themselves about the disorder, to know how to actually support the person that they're looking after, that carers need to make time for some self-care, interacting and connecting with their community and support groups. And the third thing you mentioned was maintaining an optimistic outlook and being patient with the condition that they're supporting the person that they're caring for with. We heard from Anthony Carbines and the adoption of a lot of the recommendations from the Royal Commission. Throughout the chat, I did keep an eye on a lot of people talking about the insufficient funding, particularly through the NDIS for carers. And I think that that's something we need to pick up on, and certainly through MHFA's advocacy, people should be voicing their lived experiences with these issues, and we would like to support in the way that we can in escalating some of those messages back to decision makers if possible. So thank you for your comments in that regard. We also heard from Nick O'Callaghan, who talked about the percentage of carers being from culturally and linguistically diverse communities, and the important things that need to be done to break down barriers for people accessing support, in particular breaking down the stigma. We also heard from Jim Beer about the important work that he does in supporting people and in promoting people to to make time for self-care, be kind to oneself, and to set some compassionate boundaries. And of course, from our panelists, Matt Dale, thank you for your support to the Bipolar Carers Support Group. It is one of the most amazing things I discovered when I started working with MHFA a few years ago was the amount of free resources that are available to people. And that is truly an amazing thing that MHFA provide. And I think that the more we can do to promote awareness of these important resources and support groups, the better. So keep up the good work, and thank you for your contribution and your support to people going through a really, really tough time. And of course, we've heard from Pushpa and Sonia, particularly in regards to the impact of social isolation, and also the impact that being from multicultural backgrounds and the barriers that can create in terms of people accessing support. I really love always hearing from different people and different lived experiences. And I know that it always makes for a much richer conversation. But I want to also thank all the participants for making time to listen and also put questions forward today. Before we close, I do want to remind everybody about the Walk for Mental Health this Sunday. It's an important time for us to really just reconnect with one another. Yes, it is virtual, but one thing that we can do is you might have a bubble buddy or someone in your local area that you can do some exercise with, or it could be with your own household. I know that when I first did this walk a few years ago, it gave me a really deliberate excuse to kind of connect with my dad. We did the walk together around the Albert Park Lake, and I was within earshot of a lot of people that were actually talking about why they were doing it. You know, that they had someone that was affected by a mental health issue, whether it was suicide, whether it was someone that had lost a loved one. And you could really understand that this was there was some purpose towards the walk, and certainly created a really deliberate opportunity for me to sort of have that moment with my dad and reconnect as we did the walk. This year it will be different again, but we can do this nationally. So for those interstate that can do this with a group of people, enjoy and send through some photos. But for those that are in Victoria and particularly in Melbourne, I'll be going on the walk with my family. So please log into the app if you can download it, and it would be great to hear from you all and see photos and videos of your walk. Well, that brings us to the close of the event. Thank you all for joining us. Thank you, Jim, for moderating that panel and making sure that everyone had their say, and keep the conversation going. I think it's important that the end of this forum doesn't mean we stop here. It's an ongoing conversation, and certainly we want to hear your feedback. If you want to hear from us in different ways, or you want us to address specific things next time, please give that feedback to us so that we can make sure that we're meeting the needs of all the people that are engaging with MHFA. So thank you, everyone.
Just before you finish, I just want to pay a special thanks to yourself, our MC, hostess with the mostest, Hadia, a principal lawyer and state litigation leader with Morris Blackburn, who are one of our major sponsors. She neglected to mention that, but that's really very important. So along with wonderful Australian Unity, Chemist's Own, and Foot Solutions, we heard from Bruce Wong, the manager of Foot Solutions, but especially from Hadia and the wonderful work that you do, Hadia, emceeing these events and providing support to the Mental Health Foundation. I want to thank you particularly.
Thanks, Jim. It's my pleasure. Thanks for having me.
Thank you.
Thanks, everyone. Hope to see you next time in person, but in the meantime, enjoy the walk this Sunday, and I'm sure we'll catch up at another event throughout the month.
Thank you.
Thanks, everyone.